Hey, it's Adam Sewell, MD. Let's move from theory to practice and look at real-world applications of regenerative therapies through a few case studies. These are based on typical scenarios I see in practice and are designed to show how to tailor treatment to the patient's arthritis stage, symptoms, and goals. Case Study 1, Early Stage Knee Osteoarthritis in an Active Male. Patient Profile: John is a 55-year-old recreational hiker with early knee osteoarthritis. He experiences knee pain after long walks, especially on downhill trails. X-rays show mild joint space narrowing consistent with Kellgren-Lawrence Grade 2 or Stage 2 OA. Assessment and plan. Since John's inflammation is starting but there's still viable cartilage, we recommend a combination of platelet-rich plasma and hyaluronic acid. PRP will provide biological stimulation to reduce inflammation and support cartilage health, while hyaluronic acid will help restore synovial fluid viscosity. Procedure: we perform a lateral suprapatellar knee injection using a blind technique. We aspirate a small amount of fluid, confirming joint entry, and then inject 4 milliliters of PRP mixed with 2 milliliters of hyaluronic acid. Outcome: at 2 weeks, John reports improved comfort while walking. At 3 months, his range of motion is better, and his physical therapist notes improved quad control. This case highlights the benefit of early intervention with PRP and hyaluronic acid in Stage 2 osteoarthritis. Case Study 2, Advanced Hip Osteoarthritis in a 68-year-old woman. Patient Profile: Mary is a 68-year-old retired school teacher with severe right hip pain. Imaging confirms Stage 4 osteoarthritis, near bone-on-bone. She has diabetes and is hesitant to undergo joint replacement surgery. Assessment and plan: given the severity of her joint damage, we recommend a more potent biologic, a placenta-derived protein complex, or PDPC, combined with Wharton's jelly. PDPC provides a full array of growth factors and microRNA. Wharton's jelly adds mesenchymal stem cells and extracellular matrix to help modulate inflammation and possibly stimulate regeneration. Procedure: because of the depth and complexity of the hip joint, we perform this injection under fluoroscopic guidance. We identify the femoral head-neck junction, inject 1 milliliter of contrast to confirm joint entry, and then administer the combined 5 milliliters of biologic solution. Outcome: at 4 weeks, Mary's pain score drops from an 8 to a 5. She walks longer distances with less fatigue. At 6 months, she has not needed surgery and continues her mobility exercises. This case illustrates how high-potency biologics like PDPC can offer relief and potentially delay surgery in advanced cases. Case Study 3, Moderate Rheumatoid Arthritis of the Wrist in a Working Professional. Patient Profile: Alice is a 45-year-old hairstylist with a history of rheumatoid arthritis. Her systemic disease is well controlled, but her right wrist remains swollen and painful. Imaging shows early erosions, and musculoskeletal ultrasound reveals active synovitis. Assessment and plan: to locally address inflammation and slow joint damage, we choose a combination of alpha-2 macroglobulin and platelet-rich fibrin. A2M will inhibit matrix metalloproteinases and reduce further cartilage breakdown. PRF will offer a slow, steady release of healing growth factors. Procedure: using ultrasound, we visualize the radiocarpal joint and insert a 27-gauge needle in plane to deliver 2 milliliters of A2M along with fragmented PRF. We visualize capsular expansion during the injection. Outcome: at 2 weeks, Alice reports improved dexterity and less morning stiffness. By her follow-up at 6 weeks, her synovitis has resolved on ultrasound, and she's able to work full days pain-free. This case underscores the value of regenerative therapies as adjuncts in rheumatoid arthritis. These case studies demonstrate that regenerative therapies are not one-size-fits-all. We have a toolbox of options, and the key is matching the right therapy to the patient's stage and goals. Coming up next, we'll work through some interactive scenarios and decision challenges together.